Most people plan for retirement by asking one simple question: how much monthly income will I have? They look at their 401k, their social security statements, and their savings, and they feel a sense of relief. But the question that actually destroys retirement plans is much more dangerous. What happens when massive healthcare costs show up at the worst possible time? Most retirees spend years budgeting for housing, groceries, travel, and their favorite hobbies. They imagine a life of freedom, but they almost always underestimate the weight of medical premiums, deductibles, prescription drugs, dental care, and the looming shadow of long-term care. These are the expenses that can turn a comfortable retirement into a financial crisis in a matter of months. By the end of this video, you will have a simple, actionable retirement healthcare planning system that covers the biggest risks without needing you to be a millionaire. Give me 15 minutes and you will never have to worry about healthcare in retirement again. The biggest mistake you can make is thinking that healthcare in retirement is just one bill. It is not. It is a collection of smaller costs that stack up until they crush your budget. You have to understand that healthcare is a multi-headed beast. You have your Medicare premiums, which are the baseline. Then you have Medigap or Medicare Advantage costs. You have prescription drugs that can fluctuate in price without warning. You have dental, vision, and hearing costs. Three things that are often excluded from standard plans but become more expensive as we age. Then there are out-of-pocket maximums and the massive threat of long-term care. When you add inflation over a 20 or 30-year retirement, the danger is clear. It is not about one huge hospital bill, it is about many smaller bills stacking up year after year. The biggest mistake retirees make is thinking Medicare means free healthcare. It does not. Medicare is a great tool, but it is a foundation, not a finished house. It takes a method to stop worrying. This is my 5-bucket healthcare plan. Managing these 5 buckets makes healthcare a predictable expense rather than a retirement nightmare. Basic coverage, prescription protection, out-of-pocket emergency fund, dental, vision, and hearing plan, and long-term care backup plan. Starting with bucket number 1, retirement healthcare selection. This is your biggest choice. You usually have 2 options: original Medicare and Medigap, or Medicare Advantage. The trade-off is evident, but there is no single answer. Original Medicare and Medigap offer the most freedom. You can see practically any doctor in the country, and your prices are predictable, but your monthly premiums are greater. Although Medicare Advantage plans have cheaper premiums, they have limited networks, pre-approval requirements, and plan limitations. You must consider your health, budget, and travel plans. If you choose poorly, your plan may not cover your preferred specialist. The one healthcare error that can trap retirees in a plan they loathe forever will be shown in a few minutes. Bucket 2 is prescriptions. Slowly, this expense mounts. Many people choose a plan based on their current needs, but retirement healthcare is a marathon. Drugs that are reasonable this year may be quite expensive next year due to insurance company formularies or tiers. You must check your drug coverage annually during open enrollment. Before choosing a retirement healthcare plan, verify your medicines. List your medications, doses, and preferred pharmacy. Without proper monitoring, you could pay thousands of dollars for a drug covered 12 months ago. Be proactive to avoid medication costs eating up your travel budget. Bucket number 3 is your out-of-pocket fund. Think of this as your medical shock absorber. Even with the best insurance, you will still face deductibles, co-pays, and co-insurance. You might need a specialized test or a visit to a specialist that requires a high out-of-pocket payment. To stay in control, you need a separate healthcare emergency fund that is never mixed with your vacation money or your regular savings. At a minimum, this fund should hold 1 year of your plan's expected out-of-pocket maximum. A better goal is to have enough to cover a truly bad medical year. The best approach is to have a separate healthcare reserve that you refill annually. When you have this cash sitting there, a medical bill isn't a crisis, it's just a withdrawal. This shifts your psychology from fear to total control. We must discuss bucket 4, dental, vision, and hearing. These retirement costs are overlooked. Retirees are often surprised by the cost of a crown, glasses, or high-quality hearing aids. These costs are significant. Major dental procedures might cost several $1,000s, destabilizing a monthly budget. There are several alternatives. Buy separate dental and vision coverage, join a discount program, or create a savings bucket for these requirements. Some prefer community clinics or cash negotiations with providers. Routine cleanings and exams should be scheduled immediately to avoid emergency procedures. The one expense that may wipe out years of retirement savings faster than nearly anything else is next. Next is Bucket 5, long-term care, the silent wealth killer. You must distinguish between medical and long-term care. Medical treatment heals broken arms and illnesses. Custodial long-term care is a different matter altogether. It aids bathing, dressing, feeding, and memory care. Medicare rarely covers lengthy long-term care. Many families suffer financially and emotionally here. Nursing homes and assisted living facilities are expensive, and home care prices rise annually. A long-term care plan is needed. This could be long-term care insurance, which unfortunately can only be purchased before a certain age and before you have any significant diagnoses that could lead to disability. Or you can consider a hybrid life insurance policy with care benefits. Some people self-fund or prepare for home equity and downsizing. Others plan Medicaid with professionals. Before your family makes a crisis decision, decide on your backup plan. Don't wait to do this while in a panic situation. As you build these buckets, you must avoid the 3 healthcare mistakes most retirees regret. Mistake number 1 is choosing the cheapest monthly premium. A low premium often feels like a win, but it usually means much higher costs when you actually get sick. Don't just look at the monthly bill, look at the total potential cost of the plan. Mistake number 2 is ignoring provider networks. A plan is useless if your doctors and local hospitals aren't in the network. Always verify that your specialists are easy to access. Mistake number 3 is the most common: never reviewing your plan again. Your health changes, the insurance companies change their rules, and the economy changes. The best plan for you at age 65 may not be the best plan when you are 72. You have to stay mobile and informed. Use a short annual checklist to make this feasible. You'll keep ahead by doing this annually. First, check your premiums for competitiveness. Second, compare your prescriptions to the new formulary. Third, verify your doctor's network status. Fourth, compare plan out-of-pocket maximums. Fifth, assess your dental, vision, and hearing needs for the year. Sixth, update your medical emergency fund. Look over your long-term care plan. Finally, discuss care preferences with your spouse or family and update your medical records and advance directives. Tens of thousands of dollars and decades of stress can be avoided with this prophylactic 30-minute routine. Discuss your 15-minute activity plan for today. You need to start, but not do everything. Minutes 1 through 3. List your doctors and prescriptions. List your projected healthcare costs based on your health in minutes 4 through 6. Look for gaps in your insurance in minutes 7-9. Determine your healthcare emergency fund amount in minutes 10-12. Write down your initial long-term care backup plan. Thoughts in minutes 13-15. Finished. You've planned more than 90% of the population. Retirement healthcare is daunting when it's a huge cloud of what-ifs. Breaking it into these 5 buckets makes it a math problem instead. You need not predict every ailment you may get. You can be secure without wealth. You merely need a method that accounts for hazards most people neglect. Retirement tranquility comes from a flawless strategy for anticipating poor health, not perfect health itself. Avoiding medical bills is not the goal. The idea is to avoid surprises. You reclaim authority from insurance companies and the healthcare system. Your retirement can now be about enjoying the life you worked so hard for. Please comment below to discuss. What's your biggest retirement healthcare concern? Rising monthly premiums, pharmaceutical costs, lack of dental coverage, or long-term care fears? If this was useful, save the checklist and start your plan now. Future you will appreciate the peace of mind you're establishing now. Stressful retirement versus free retirement depends on planning. Stay informed and stick to the buckets to be ready for everything. Please subscribe to this channel and like the video so that this information is provided to others needing financial advice. Hit the notification bell to never miss a video helping you to navigate retirement-related finances.